It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 14 of My 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 15 of My 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can find previous questions answered from this series of questions by clicking on the links below this video in the written version of this blog. And if you are watching this on YouTube, please click on the link below the video. That'll get you to the website, to all of the other episodes and all the other resources on our website. So Robert continues with his mother's situation here. And Robert writes, "Hi Patrick, a few updates and questions since my last email. The main issue right now is that her platelets are still very low, 24 in the latest blood count. I have not had a chance to talk to the doctor yet. They have said they're going to hold off on giving her any platelets yet because there's a chance that the body is fighting the platelets and that sometimes trying to transfuse platelets only exacerbates the issue and causes the body to fight harder. Does that make sense? The next question that I have is, they were able to do the scope to see if they could see what might be the cause of the bleeding they found. They were able to find two small ulcerous areas. The nurse said that if they were going to find anything, that's not a terrible thing to find, as they can treat with Pepsid and they often self-heal. Also, the procedure itself went well and without any incidents. They also found hemorrhoids in the rectal area. Next question that I have is, the next comment that I want to make is, the hemoglobin has improved a little bit and is 76 and is staying stable. Next, her blood pressure medications, also known as inotropes or vasopressors, they're keeping them at a very low level, 0.2, and she's doing fine on that front. They're keeping them on rather than taking them off completely because she's usually needed to have them back on at least just a little. So rather than bouncing on and off, they're going to leave them on at a very low level for now. Next, they're likely going to try feeding via the tube versus intravenous feeds tomorrow and see how she can tolerate it. Next, her white blood cell count went from about 20k to 17k. Hopefully it continues to trend downwards. Next, overall she looks about the same as yesterday. Her breathing rate is still about 24 breaths per minute, and she looks comfortable and peaceful. They're giving her a low dose of pain meds, fentanyl, 0.25, continuously right now. Number 9. The fluid removal I had talked about earlier was near her spleen. It was a one-time thing and they haven't seen any since then. So that doesn't seem to be a concern for them. Next, they have been able to extract 1.7 liters of fluids via the dialysis in the last 24 hours and a liter the day before. She's still responding well to the dialysis. She looks way less puffy than she did, and the nurse says she can see the difference throughout her body. My big questions, and there's also, I think, is around the platelets. I don't think they know what's causing the low platelet count. I'm not sure if the ulcerous areas would contribute to that, or the high level of fluids, or the earlier infection, or something else. As always, any feedback and comments are appreciated. As for the family, the last couple of days have been tougher than usual because of this new platelet thing. We were hopeful that once on dialysis, as the infection was under control, she'd be able to get back on a positive trajectory. That hasn't happened yet, and it's unclear what's causing the platelet issue. Many thanks from Robert. So before I get into my response, if you want email counseling or phone counseling with me, one-on-one phone or email counseling with me, go and check out the options on the top of the website, or simply give me a call on one of the numbers on the top of the website. So here's my response. Hi, Robert. Thank you for the update. So here are my comments to your questions. So the first question you had was the main issue right now is that her platelets are still very low at 24 in the latest full blood count. You have not had a chance to talk to the doctor yet. They have said that they are going to hold off on giving her any platelets yet because there's a chance that the body is fighting the platelets and that sometimes trying to transfuse platelets only exacerbates the issue and causes the body to fight harder. Does that make sense? So here's what I think, Robert, about this. I have not heard of holding off platelets because of chances the body fighting the platelets. That would be new to me. But because they are in the dark about what's causing the low platelets, I strongly feel that they need to get a specialist involved, namely a hematologist. If they can't find the cause, I believe rather than holding off giving platelets and potentially exacerbate the bleeding, a specialist needs to find out what's going on. Most patients in ICU with low platelet count are hematology patients or are patients after multiple trauma where they lose massive amounts of blood. Especially for hematology patients, a specialist tends to be involved and can direct any findings and then also treatment to the intensive care team. The next question you had, Rob, was they were able to do the scope to see if they could see what might be the cause of the bleeding they saw. They were able to find 2 small ulcerous areas. The nurse said that if they were going to find anything, it's not a terrible thing to find, as they can treat with Pepsid and they also often self-heal. You're also saying that the procedure itself went well and without incident. They also found hemorrhoids in the rectal area. So here's what I think about that, Rob. That's exactly what I meant in one of my previous emails. The small ulcerous areas may well be a result from holding off nasogastric or enteral feeds. By giving intravenous feeds like TPN, which stands for total parenteral nutrition, there is a much higher likelihood of gastric ulcers developing, and especially with your mother's recent history of gastric bleeding and gastric perforation, the protection of the gut flora should have priority through the nasogastric or enteral feeding. I perfectly understand the need for IV nutrition or TPN immediately after gut surgery, but it's now been a week and therefore the protection of the gut or stomach flora should also be given priority by recommencing enteral nutrition or nasogastric feeds to maintain a physiological stomach or gut flora. And yes, ulcers do often self-heal, but even more so under physiological conditions, which are feeds, plus the Pepsid. Now, do you know whether they're still giving the intravenous nutrition, TPN? If so, do you know why they're not giving the nasogastric feeds yet? Think about it. They could even start small by giving 20 mils per hour and then gradually wean off the IV nutrition by increasing the nasogastric feeds. Next, you are saying that hemoglobin has improved a little bit and is now 76 and staying stable. Well, 76 is stable-ish. It's not fantastic, especially since hemoglobin binds oxygen in the blood. Anybody in ICU needing to be weaned off the ventilator should have a hemoglobin above 80 at a bare minimum to support weaning off the ventilator and oxygen. Weaning off the ventilator is not priority yet, given that your mother is battling other major issues at the moment. Do you know, A, when she had the last blood transfusion, and B, if there are any more signs of current active bleeding? That would be good to know. Next, You are saying, Rob, that blood pressure medications like the inotropes and vasopressors, they're keeping them at a very low level at 0.2, and she's doing fine on that front. They're keeping them on rather than taking them off completely, because she's usually needed to have them back on at just a little. So rather than bouncing on and off, they're going to leave them on at a low level for now. Well, here's what I think about that. I think that's fine. The inotropes and vasopressors for low blood pressure is nothing unusual in the face of hemodialysis, fluid removal, as well as what your mother has been through in recent weeks, including the active bleeding. I'm not too worried about it at this stage, especially in such low doses. Next, you're saying they're likely going to try feeding via the tubes versus IV nutrition tomorrow and see how she tolerates it. That's fantastic news, and that's exactly for the reasons that I mentioned before. Next, you're saying that her white blood cell count went from about 20K down to 17K, hopefully continues to trend downwards. Well, Rob, it's still fairly high, but even in non-infectious ICU patients, it can be fairly high, and as long as her inotropes or vasopressors are down and her white cell count is slowly coming down, I'm not too worried. It's still wise to keep monitoring a masked temperature whilst on dialysis, as I mentioned in my previous email, but I tend to agree that monitoring the white cell count is the best indicator to keep detecting an infection. Next, you're saying, Rob, that overall she looks about the same as yesterday. The breathing rate is still about 24 and she looks comfortable and peaceful. They're giving her a low dose of pain medications, such as fentanyl at 0.25 continuously right now. Well, that seems an improvement compared to your emails from yesterday. Pain must be well controlled, and a breathing rate of 24 breaths per minute is indicative of her comfort, whilst only having a low dose of pain meds such as fentanyl. I also feel that it's very important for you and your family to know that in spite of all the challenges and setbacks, you know that she's comfortable. The minute you and your family feel that she's going through too much of a struggle, pain and discomfort, you may have to rethink the outcomes that you want to achieve, at least from my perspective. Next, you're saying that the fluid removal you had talked about earlier was near her spleen. It was a one-time thing, and they haven't seen any more fluids in the abdominal area since then. So that doesn't seem to be a concern for them. Well, I'm very glad to hear that, Rob. I was very concerned yesterday about the potential for liver failure with fluid accumulation in her abdomen that needed draining. If the fluids don't come back, then I take for face value that it was a once-off and the problem has been resolved. Next, you are saying that they have been able to extract 1.7 liters of fluids via the dialysis in the last day and a liter the day before. She's still responding well to the dialysis. She looks less puffy than she did before, and the nurse says she can see the difference throughout her body. Well, that's great news, Rob, and it's good to hear that you and the team can visibly see that dialysis is making a difference. Do you know if your mother is still making a little spontaneous urine, or have they taken the catheter out? Now, your next big question, Rob, from what you wrote, is about the platelets. You don't think they know what's causing the low count. You're not sure if the ulcerous areas would contribute to that, or the high level of fluids, or the earlier infection, or even something else. Well, Rob, I think they're all in the dark, including myself. Again, from my perspective, they need to get the specialist in, a hematologist. The only other thing that I can think of is the dialysis machine and the filter the blood is running through, causing a quote-unquote destruction of the platelets. This is very rare, but it may be a reason why. Also, she may develop an autoimmune reaction of something causing the platelets to drop, as well as potentially having a reaction to any drugs being given. But that's way too much speculation on my end, and hence the need for a specialist to look at. I hope they don't wait until Monday to get that specialist in, but move on this rather sooner than later. Now, you're also saying that your family the last couple of days has been tougher than usual because of this new platelet thing. You were hopeful that once on dialysis, as the infection was under control, she'd be able to get back on a positive trajectory. That hasn't happened yet, and it's unclear what's causing the platelet issue. Well, this is a very tough time for you and your family, and I believe even though in the midst of this massive challenge, you and your family have not given up hope. You and your family should be proud of what you are doing by not giving up and supporting your mother through this massive challenge. Even though you may feel at times that your mother can't hear or see you, most patients coming out of intensive care, out of an induced coma, don't recall the details of their ICU stay, but can recall their loved ones being around, which often makes a big positive difference. So, give you and the rest of your family a pat on your back for being so strong. It's easy to lose sight and perspective during those highly emotionally charged situations. Therefore, keep doing what you're doing for now. Your mother is alive, fighting nasty and massive challenges. Hopefully they can get an answer and a solution for the platelet problem. Start feeding her and then get back on track with starting to wean her off the ventilator and then also starting to wean her off dialysis. As for the doctors and the nurses, what's their situation? Do you feel they are more positive or negative? Is there any more talk about withdrawing treatment? Hopefully you can share that in your next email. Thank you from Patrick, and all the best to you and your family. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.